everybody, it's Dr. Kathleen Walls here, co-owner of Green Street Animal Care, otherwise known as GSAC, and you are joining us on GSAC TV. Today we're going to be talking with Dr. Louise Wade of Wyncote Animal Hospital, who is also our visiting veterinarian twice a month, usually on the second and fourth Monday of every month. Today we're going to be talking about vaccinations and their importance. So come on back and join us as we talk to Dr. Louise Wade.
Hey GSAC TV, I'm the GSAC dog. I am due for all my shots. Sergeant Mojo is going to get all his shots today. His rabies, DHLPP, and his Bordetella. Dr. Wade is doing it.
So here's the question. We can take a online poll. How many think that Mojo is going to be good for his for his needles? Mojo, look at that face. Look at that face. Look at that face, everyone.
Sit, Mojo.
Cute, darling, innocent face. And we'll take a poll. And how many people think that Mojo's going to be the perfect gentleman for his?
I don't like being a gentleman.
I'm sure his puppy mama is going, Okay. She knows.
Hey.
So, Dr. Wade, what vaccinations are we going to use and what is their purpose?
Okay, so he is actually going to be receiving 3 vaccines. 2 of them are what we would consider core vaccinations, meaning the vaccines that every dog should have to maintain good health. Rabies is definitely one of them. It's one of the important ones because it's also legally required for dogs to be current and up to date on their vaccine. The reason being is rabies is a zoonotic disease, which is a disease that can be transmitted from animals to human beings. And so it's really important to make sure that we protect our animals from getting rabies virus infection, which can be transmitted usually through the saliva of an infected animal, through bite wounds usually. If there's a scratch and the wound is open and then some of the animal's infected saliva gets into the scratch, it can be transmitted that way.
Okay.
So we want to make sure that our dogs are fully protected because dogs like to chase sometimes, and they like to chase after smaller animals like squirrels or possums, especially raccoons. If we're in the city, those animals that like to come into your garage and around your vicinity, your trash cans and things of that nature. So if your dog is doing its job and being a protector of its territory, he might encounter one of these animals, heaven forbid if they have rabies and he bites them or gets into a little tussle with them. He's at risk for being infected. So we want to make sure that he is protected and vaccinated. And when your animal is protected and vaccinated, that makes you safe so that you don't get the zoonotic infection. So that's why it's important to vaccinate against rabies. The other core vaccine for dogs is their distemper. It's usually abbreviated distemper, but it's usually a combination vaccine that has several different vaccine components that we are vaccinating against. So the distemper, his will include parvo. Most people are familiar with the parvo virus, and we want to make sure that our young puppies are protected against parvo because that's a very devastating virus for young puppies. But it's also something that we annually and sometimes every 2 years or every 3 years, depending on the different protocols, we'll vaccinate them against as they get older. And so the parvo is the component that he's also going to receive in this other shot. Parainfluenza, which is like a common cold virus that dogs can get. We don't typically see a lot of infections against that because we've been vaccinating them diligently with their core vaccine. So we don't really see these virus outbreaks, fortunately, because we've been doing a good job of containing them with the routine vaccine protocols. But then there's also lepto component that's going to be in the vaccine that Mojo gets today. And lepto is a zoonotic disease that can be transmitted by small mammals like raccoons, possums, squirrels. And so we want to make sure that we protect our dogs against that. Now, not every dog has to get the lepto vaccine, but it is what we consider a re-emerging disease. We're starting to see more cases of it. For years and years and years, we weren't really seeing a lot of positive lepto cases because we had successfully, quelled the outbreaks with vaccine routinely. But as dogs become more purebred, we're starting to see some animals might be having a hereditary predisposition to vaccine reactions.
Okay.
And so through the years, a lot of people would kind of stay away from vaccinating against lepto because it tends to be one that can be more reactive for a dog that has allergic reaction to the vaccine. And so, some places will not vaccinate against lepto, some places will. More and more now we're seeing it being a requirement for a lot of kennels that have a large volume of dogs coming in to make sure that the animal is protected against lepto, because we have started to see some reemergence of that infection. Okay. So his core vaccine will include today rabies, distemper with parvo and lepto, but then we're also going to vaccinate him against bordetella. So that's not really considered a core vaccine, but because our friend Mojo here is the GSAC dog.
Yes.
And he's constantly being a Mr. Congeniality,
yes, he is.
a greeter of all of the dogs, a buddy to keep everybody calm when they're boarding for the first time, and a playmate for all of his doggy friends. So he's around a lot of dogs all of the time.
Yes.
So it's important that we protect him against kennel cough infection.
Okay.
So that's why we're vaccinating him against the kennel cough. The bacteria and virus that can contribute to kennel cough infection.
Okay.
So he's going to get that today. So if your dog is going to doggy daycare, if he's going to board, if it is a show dog, it's going to be in an environment where it's going to be around other dogs in close contact regularly, it should be vaccinated against bordetella. Or puppy training class is another setting that you would want to consider doing the bordetella regularly. Some people ask about whether or not they need it for grooming. I think it really depends on the setting.
The facility.
So, right. If the facility is one that allows the dogs to commingle and they're nose to nose, then I would recommend it. But if it's, or the dog park, like if it's an open air space and there's not a whole lot of direct contact, then it's not necessary.
Okay.
But those are the vaccines he's going to get today.
All
so
right.
we'll go back to our online poll.
So let's see.
Let's see if your response is in. Do we have 20% saying Mojo will be not so happy about his vaccines, or do we have 90% saying
That's right.
Mojo's going to be a perfect gentleman?
Vote for me, Sergeant
Get
Mojo.
your votes in now, folks.
Sergeant Mojo. Vote for me, Sergeant Mojo. Hey, Joe Davis, vote for me, Joe Davis. Joe Davis, vote for me.
All right, Mojo, you got to represent the GSAC well. We're going to do the bordetella last because I don't think that's going to be happy times for Mojo.
Now, I know when my father would do the vaccines, many times he stuck it in the, what was it? I think in the back or shoulder or somewhere up top. But now you usually put them in the leg.
Right.
And the reason for that?
So, a lot of injections are given in this area.
Yes.
That's probably what you were referring to.
Yeah.
This is what we call their scruff. There's a lot of loose skin there, so it's kind of easy to grab up some skin and poke them there. That was something that, was done, but as time progressed and we started to see some adverse effects of some vaccines, animals that would develop a nodule or growth or injection site tumor at the site where the vaccine was given, if they develop that, and those are very rare. We don't see, as often as we vaccinate animals, we rarely see injection site sarcomas or tumors associated with the injection. But if they do occur, if they're given in this area, to try and remove it in its entirety is very difficult. And if it is an injection site sarcoma, those are usually aggressive tumors, which you have to make a deep and wide excision to get all of it out. And being in this area, deep and wide, is not going to actually be very good successful because there's a lot of muscle in that area. So a lot of times the tumors would grow once they develop and we find out what they are, they grow so aggressively that they grow deep into the tissue. And so trying to successfully remove all of it is not going to be a good chance of getting it all out in that area. So there have been protocols that have been developed to try and make sure that if they do develop a injection site sarcoma and it needs to be removed, if we have to amputate the limb, in some cases it's easier to get all the tumor out with the limb amputation. So that's why we do them, try to do them low and in the back. If we have to give them in the front, we'll do them low on the forearm and not high up against the shoulder blade.
Okay.
Hey, you
All
ready?
right, Mojo, showtime.
Oh boy, here I go.
Mojo said it's always showtime.
And a lot of people are super scared of vaccines. Even with humans, you have people who don't want to vaccinate their children. There's this whole debate about schools, whether or not we're going to make it a requirement for people to vaccinate their their children to come to school and things of that nature. But the amount of vaccines that we do, again, like I said, it's very rare that we see in reactions or adverse effects. Look at Mojo, perfect gentleman. All right, good job. That's one
And a little
down.
kick out on the side there.
Right, he's like, let's see, I did it. You dancing, Mojo? See, you showing all your doggy friends how easy this is.
That's right. You so perfect,
Oh, good
Mojo.
job.
Hey, I'm
Good
Sergeant
job.
Mojo.
Oh.
Good job, Mojo. But now he's more aware. You see him looking back, he's like, oh, I know what you did to me.
He's so good.
But he's doing
Momo.
such a good job. He's a brave, look at, good boy. Look at Mojo.
Being
All
a model
right.
GSAC
Good
dog. That's
Mojo.
right.
Okay, now give me my snacks. 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 Hey, roll.
Oh, good puppy, good puppy. All right, so here is the moment of truth. Here, we might have to
Okay.
employ the snacks for this part because this has to go in his nose. You don't
Mojo,
like that,
relax.
right?
And so now they used to have Bordetella that was injectable, but now
They
it seems
do.
as though they still do.
Yeah, they
Okay.
do. They do have the injectable form, so that is definitely, and they actually have an oral one as well.
Oh, do they?
Yeah, the oral one would go kind of like in the cheek pouch right back there.
Okay.
Hey,
So
be nice.
a little squirt.
Mojo.
Mojo, come on,
Hey.
be a perfect gentleman.
Stop it.
Good boy. Good boy. Good boy. Relax, relax. Mojo doesn't like this. Oh, good job, Mojo.
Yeah. Good job, Momo.
He's a
Yay.
good boy.
Yay. The crowd
All
is
of
cheering,
those who
Mojo.
voted that Mojo was going to be a perfect gentleman. You guys
That's
win.
right.
That's right. Good job.
Yay.
Says Stephanie, I'm ready for my groom. I'm ready for my groom now.
Wait, he's got to get a butt rub. Look at that. That's right. You got to get a butt rub. Good
Oh,
job.
that's funny. Now, we talked about vaccines with dogs. What about with cats?
Okay, so for kitty cats, the core vaccines are a rabies vaccine and then FVRCP,
Okay.
which is a combination vaccine against several different viruses, most of them upper respiratory viruses that affect cats. So a lot of people feel, differently about if they have a cat and it's an indoor-only cat, they don't think that they should get vaccines. If the cat is going to be rehomed,
Yes.
and it's going to go to a home with another cat,
Yes.
then having those vaccines protects it. If it's going to come to a facility for a bath, even
Yes.
if it's not going to stay for an extended period of time, if it's going to be around other cats, that's certainly something that you want to consider. If you are going to board your cat, then those vaccines are going to be required to be in a facility where other cats have been.
Okay.
And if the cat by chance gets out, if it runs out of the house and it's out missing for a couple days, you definitely want to make sure that it is current on vaccine so that it can be protected if it gets exposed to other animals. There is also a vaccine for feline leukemia. That one is recommended for cats that are indoor and outdoor,
Okay.
or in a multi-cat household, because leukemia virus is something that's easily transmitted through casual contact between cats, grooming one another, eating and drinking out of the same food dish.
Okay.
So those are all things that you will definitely want to consider protecting your cat against. But it is not, feline leukemia is not considered a core vaccine. It's not something that every cat needs. So that's one of those situational type vaccines.
Okay.
It depends on the situation.
And I'm glad that you said sometimes, the cats do get out, the dogs do get out, because a lot of times people say, well, I don't want a vaccine because they stay in the house.
Exactly, right. So generally, if you think about like with your children, when they're very young, they get several boosters. When they come to the doctor, they have to get a lot of shots and a series of vaccines as they come in very frequently. So similarly with cats and dogs, when they're kittens, we start them out with several boosters. And then after that, we come in and we bring them back for their annual checkup and we boost those vaccines. So every time we give them the vaccine, what we're doing is we are causing their immune system to gear up and make more antibodies so that they have a protective level to fight off those infections that we're trying to protect them against.
Gotcha.
So when we give them their routine boosters, we're boosting the immunity that they have against those viruses.
Okay.
Now, also, when we give them the vaccines, we are challenging their immune system to respond. So animals that are sensitive or may have an allergic reaction, when we give them the vaccine, we are kind of awakening their immune system to foreign substance. And so, so if the animal has allergic reaction, I do not I should say not recommend, but I am in favor of not vaccinating them as often. Because one of the things that we do know through research, and there's a lot of studies in terms of the length of the effectiveness of the vaccine.
Okay.
We do know that they are effective for much longer than just a year. So we don't have to vaccinate them annually. So we can start to spread out their vaccine. So there are some places that'll do a protocol where they vaccinate for distemper every 2 years or every 3 years, because the manufacturers have labeled their effectiveness for much longer than what we vaccinate.
Okay.
I am one that I'm more of a proponent of doing a tailor-made approach for every animal. Mojo is in constant contact with many dogs. So you want to make sure that Mojo is very current and very protected.
Yes.
And so to vaccinate him more regularly is a good idea.
Yeah.
But if you have a dog that is in the apartment with its owner and it doesn't go to the dog park and it's not social with other dogs and it rarely goes out to get groomed, it's not really in a setting where it's going to be around or amongst other dogs frequently, then there's no harm in spacing out those vaccines.
Okay.
However, the I would say the first 3 years are kind of crucial in making sure that they get their boosters so that their body can make the protective level of antibodies.
Gotcha.
So that they can stand strong in the face of or affront to, infection.
Yes.
And so when they're puppies, they need to get their full complement, their series of shots. That first year is really crucial to come back and boost those vaccines to make sure that you get that protective level of antibodies in their immune system. And then probably that third year again, hitting them again with another, booster. After that, if you wanted to do an every 2 year distemper, that would be fine. Or some places will do an every 3 year distemper, that's fine. If you have a dog that you gave it the puppy shots and then around that second booster he had a severe allergic reaction, doesn't mean that he can't have vaccines ever again.
Okay.
What we do is we'll pre-treat them to protect them from an allergic reaction. So we'll pre-treat them with a Benadryl injection before they get their vaccines, so that they don't have those allergic symptoms. And we still want them to be protected against those viruses, so we still can vaccinate them, but we don't have to necessarily vaccinate them every single year. But if the dog is going to be in a situation where he's going to be frequently around other dogs, he should be vaccinated regularly, and we just do the protective measures as far as the pre-treatment with Benadryl before we vaccinate them. So it really just depends on the dog, what their living circumstances are going to be, and all those things. But an initial first 3 years of making sure they get those, regular vaccines, I think it's a good start. And then after that, if you want to talk about, I think having a conversation with your vet and trying to do your research and determine what are the risks. The other vaccines that we didn't talk about that are not necessarily core vaccines, there's a Lyme vaccine. Vaccinating against Lyme is something that is much more important for people that live in the city nowadays than it was in the past. Because we're starting to see more and more cases in our area. We didn't usually see that many positive Lyme cases back in the day, and I mean like decades ago. But more and more we're starting to see positive Lyme cases even in the city because the landscape is changing. We're starting to move out into the suburbs and we're disturbing the natural habitat of the deer, and now the deer population is starting to come into the city. And so the deer are the animals that actually act as a vector. They transmit the host. They're vector or host for the tick that transmits Lyme disease. And so they're like a transmit host. They bring the tick closer to your dog. And so the ticks that transmit Lyme disease, are on the deer. So if you see deer on your property, in your vicinity, or if you take your dog to a dog park where you see deer, those are the dogs that you want to protect against Lyme. So if you found a tick on your dog and you're not sure if it was a deer tick or not, bring your dog in, have it tested for Lyme, make sure that it's negative. If it's negative and you have thought about the fact that, I do see deer in my area, or I do take my dog to that park, then you want to protect your dog against Lyme. And so one of the things that you can consider is the Lyme vaccine. The best measure to protect your dog against Lyme is to, first of all, never let it get a deer tick on it. Because nothing's 100%. So even the vaccine for Lyme is not 100% protected. It's an added measure of protection. But the best measure is to have them on an effective tick preventative. So
Gotcha.
you want to make sure they're on regular flea and tick control to prevent them from getting the deer tick in the first place.
Got it.
Now, again, nothing's 100%. So the tick preventatives don't prevent 100% of
Right.
ticks from getting on the pet.
Right.
But what they do is they kill the tick before it has time enough to transmit the infection. So the tick is going to attach to your dog. It's going to remain attached because it's going to be feeding on a blood meal on your dog. And so within that 48-hour period, it has an opportunity to transmit the bacteria that causes Lyme
Got it.
disease. And so what we want to do is we want to get them on an effective tick preventative so that it kills those ticks quickly so they don't have a chance to transmit the infection.
All right. Y'all heard it from Dr. Wade. We'll talk to her another day. Thank you.
Take care. You're welcome.
All right.